What is bronchial artery embolization and when is it needed?
Basically, let us understand why we do it. Whenever we have a patient who has massive recurrent hemoptysis, which is coughing out a lot of blood, then we do a procedure called bronchial artery embolization. Why generally a patient coughs out a lot of blood or massive hemoptysis happens in Indian scenario? It is because of pulmonary tuberculosis. How do we do it? It is done under local anesthesia without any cutting or stitching, small puncture in the groin at common femoral artery, and then we go inside the chest area and we examine all the blood vessels that is related to that area of cavity. And once we examine, most commonly the bronchial arteries, the intercostal arteries, the internal mammary arteries, and if we find a bleeder, most commonly once we find the bleeder, we go inside with a small catheter and we inject PVA particle, gel foam, or liquid embolics to occlude the bleeding point and the vessel. So that precisely gives us a good control over this hemoptysis.
Why is bronchial artery embolization better from conventional modality of management?
Conventional modality of managing hemoptysis is the first one is the medical management. We give medical management, medical treatment to a patient who is having hemoptysis. Once it is controlled with medical management, we do not have to do anything. But when a patient is bleeding and medical management fails, what are the options? We have two options. One is an open surgical treatment, one is an endovascular treatment or bronchial artery embolization. So that completely takes out the disease as well as the normal part of the lung. So that's why it's a major surgery and it takes out the part of the lung. So that should be done at the last resort, as the last resort. So bronchial artery embolization instead is done under local anesthesia within 45 minutes to 60 minutes time it takes from a small puncture in the groin. You find the bleeder and you occlude them. Once the bleeding stops, we are happy. And 75 to 90% of the time, you will be able to successfully treat the recurrent hemoptysis through bronchial artery embolization of one sitting.
What is your clinical experience on the outcomes seen in your patients?
As I said you, one sitting of bronchial artery embolization helps around 75 to 90% of our patients in controlling the hemoptysis.
What is the literature evidence for this procedure?
Literature supporting bronchial artery embolization as a mainstay of therapy in case of massive recurrent hemoptysis. Numerous papers are there. Literature fully supports bronchial artery embolization for recurrent massive hemoptysis.
What is the message you would want to give to the general physicians about managing the patients in their OPD after the procedure has been done by an interventional radiologist?
Next morning, patient is comfortable to walk, go to the toilet and do and eat everything as a normal person. And we want that the patient should refrain from any heavy activities for next 3 to 7 days. After that, the patient is free to do everything. But bed rest is not recommended after 1 day.
What is radial approach and how is it beneficial to the patient?
We are doing basically a study to understand how radial artery approach for bronchial artery embolization is beneficial over femoral artery approach. Basically, in that we are looking at the radiation dose, the time taken to do the procedure, and the outcome. All these three we are comparing, and we will try to understand how it works. But for patient, if we do radial, they are more comfortable. So that can be the new approach, the next level of approach instead of femoral.